Hi there, my name is Chandra Wells, and I'm going to be discussing my integrative review of neonatal abstinence syndrome. According to the National Survey on Drug Use and Health, the rates of illicit drug use in pregnancy have drastically increased in all age groups, race, and during all trimesters. Neonatal abstinence syndrome, or NAS, has become a major issue in the United States and is wildly prevalent in Kentucky. Kentucky is in the top 5th for non-medical use of pain relievers among all age groups. Neonatal intensive care units serving the rural population of eastern Kentucky can identify that substance abusing mothers and the resulting diagnosis of NAS has never been more prevalent. The use of non-medical pain relievers in the past year in large metro, small metro, and urbanized areas has actually decreased, while in completely rural areas, the use of non-medical pain relievers continues to increase. With the drastic increase in substance abuse in pregnancy in the state of Kentucky and in rural areas, NAS is a grave concern to all healthcare providers. Infants suffering from NAS exhibit signs and symptoms of withdrawal similar to those exhibited in adults: sweating, irritability, tremors, seizure, insomnia, vomiting, loose or watery stools, crying, skin excoriation, and poor feeding are a few of the symptoms associated with the diagnosis of NAS. Caring for infants suffering from NAS and their families present many challenges to nurses as well as members of the healthcare team. A majority of mothers feel extreme guilt for exposing their infant to these drugs, be it prescription abuse or illegal drugs. Mothers struggle with a lack of coping mechanisms, depression, and often lack support from family and friends. NAS is easy to identify in most instances, yet treatment and symptom control remain difficult. Nurse practitioners must advocate for the infant and protect them from future harm. At the same time, they must support and guide the mother to overcome addiction and help them identify their role as a mother. Study findings suggest that a deeper awareness of nurses' personal limitations can lead to a partnership between healthcare providers and the mother, leading to improved care of the affected newborn. Using King's goal attainment theory to identify self is key in providing care to both the infant diagnosed with NAS and their family. 2 qualitative and 8 quantitative studies were included and reviewed from scholarly peer-reviewed journals, increasing scientific merit. There were no relationships between the infant's sex and the peak dose of medication required for treatment. This study demonstrates the importance of utilizing King's goal attainment theory and the concept of transaction. Both national and international studies were included to seek the most current evidence-based practice for the care of infants diagnosed with NAS. The nurse must rely on the transaction between the infant and nurse to guide treatment needs. The infant's gender cannot be a determining factor in how NAS therapy is initiated and followed through. The nurse's transaction and assessment of the infant's needs are key in treating NAS. Nurse researchers and participants were included in 7 of the 10 articles, increasing the applicability to nursing practice. Conducting the literature review, it became evident little research has been done to assess the reliability and validity of the Finnegan scoring tool. Continued research to discover the best management of infants diagnosed with NAS is of utmost importance. To allow rooming in of infants with drug-dependent mothers requires superior nurse-patient family transactions. The nurse must assess the mother to ensure the infant is properly cared for with no dangers ensue. Nurse practitioners must empower substance abusing women to seek counseling and speak openly and honestly about their addictions. Infants diagnosed with NAS are usually admitted to NICUs. These admissions increase healthcare costs, utilize NICU resources, and interfere with mother and infant bonding. Treatment days were less in infants cared for by their mothers when compared to infants admitted to the NICU. Length of hospital stay was also shorter for infants cared by their mothers rather than nurses. NAS in drug-exposed infants is a major problem locally, nationally, and internationally. With multiple means of treatment and management of infants diagnosed with NAS, vast research on the topic has been conducted. Nurses, nurse practitioners, and other members of the healthcare team must develop and disseminate formalized education in regards to the treatment, care, and management of NAS infants and families. Due to barriers experienced in caring for NAS infants and families, providers need to have both A, formalized education on substance abuse and its effects on the infant and family, and B, an understanding of the influence personal attitudes have upon the infant and family as well. Implementing the findings from this literature review, along with the concepts of self, transaction, and communication from King's theory of goal attainment, will assure quality care is delivered to infants diagnosed with NAS. Thank you.